Thanks all. Hope you can hear me. I'm here to talk about the work that Manchester Care and Repair does within or associated to the hospital setting. I don't want to dwell on the wider work that Care and Repair does, because a lot of you will know about it already. So on your tables there's a leaflet that gives you the background detail. So, we're a home improvement agency, often abbreviated to HIA, and we provide non-medical, low-level housing-related support. It's always been person-centred, it's always been holistic and wraparound. So all this talk about an asset-based approach is what organisations like ours have been taking for a long, long time. It's about promoting independence, choice and well-being, helping to make sure people's homes are warm, safe, secure and adapted to their needs, particularly as they age. And we also work to facilitate hospital discharge and prevent readmission. We're an independent HIA, we're a registered charity and we were founded in 1991. We offer a wide range of completely free services for over 60s in Manchester. Those free services include home from hospital follow-up, hospital discharge support, handy person and falls prevention, which includes child accident prevention in North, technical support with repairs and adaptations, our home visiting caseworker service. We're funded by Manchester City Council Strategic Housing Investment Team, Manchester Health and Care Commissioning and various charitable trusts. We don't receive any funding direct from the hospital trusts, but we do work closely with them. Since October 2012, we've been telephoning everybody aged over 60 who's a resident of Manchester after they've been discharged following an inpatient stay or a visit to A&E. And we've been doing that from North Manchester General, MRI and Wythenshawe hospitals. We check that the patient's doing okay. We explain the range of free services that we can offer, and we take a referral at the time of that call or send an information leaflet out if requested. We have developed what I can only describe as a workaround to get over the data sharing and information governance issues, which is that our staff have honorary contracts of employment or secondment agreements with each of the hospital trusts. And we make those follow-up telephone calls from the hospital sites. In 16-17, we telephoned over 20,000 patients, made contact with 11,608 and 1,127 accepted one of our services at the time of the call. That's at the time of the call. Many, many more come back in subsequent days and weeks. And each of the hospital sites monitors the over 60s 30-day readmission rates and saw a significant decrease in those rates once the follow-up calls were embedded. We also operate an enhanced discharge support service at North Manchester General and intermittently at the MRI. I believe that a similar service is operated at Wythenshawe by British Red Cross. So since April 2013 we've been working at North Manchester General. We work 7 days a week from midday until 8:30 in the evening, and we offer personalised discharge support for vulnerable or isolated patients. We take them home and settle them in. We check that the home is safe and warm. We carry out small practical tasks such as doing emergency shop, putting some credit on a prepayment utility meter, and we make onward referrals, both within our own organisation and to others. And we offer follow-up telephone support to those individuals. They're people with low-level support needs. They have to be able to transfer into a car, so we're not an ambulance service, and we don't deliver personal care. It's not a medical intervention at all. In 16-17, we supported 1,692 patients. And we also ran a 6-month pilot at the MRI from October 16 to March 17. Unfortunately, at the end of that pilot, 6-month pilot, the service was decommissioned, but it was then recommissioned 6 months later, which is one of the real headaches that our organisation and others has to overcome all the time. Pilots and short-term contracts are the bane of my life. I'll also go back to the follow-up telephone calls that we make and just point out that although we started the service way back in 2012 as a home from hospital follow-up post-discharge, one of the hospitals, I won't name them or embarrass them, one of the hospitals couldn't tell me who they had discharged for almost 18 months. So the service was there and it was available, but that's a tricky one. So handy person and falls prevention, since 2012, it's open access, there's no means test, it's cross tenure, it's available for anyone aged over 60. We look at minor repairs in people's homes, we install free falls prevention equipment. Our handy person team is our eyes and ears on the ground. They can spot things in someone's home, bring those issues back, and we can make, as I say, an onward referral to one of ours or a more appropriate service. We also take referrals from discharge teams at all of the hospitals in Manchester to undertake work that facilitates hospital discharge. In the main, that would be installing a key safe for secure carer access, moving furniture to facilitate ground floor living during recuperation, that kind of thing. And in 16-17, we did over 7,000 individual jobs. 30% of those related to minor adaptations, installing second stair rails, grab rails, that kind of thing, or hospital discharge work. I won't bore you with what the DCLG financial benefit tool is, but it's government issued by the Department for Communities and Local Government several years ago, and it basically is a very conservative estimate of the financial benefits that accrue from a handy person service. And in 16-17, using that tool, the outcome or the results of the data analysis was that the service had prevented 114 falls, and that for every £1 invested in that service, a saving of £1.36 accrued to health or social care. Some nice pictures now. This is on the left, Steve, a former firefighter, I have to say, who has worked as a handy person for us for the past 10 years. He's installing a carpet trim at the threshold of a doorway to secure a carpet and prevent a tripping and falls hazard. On the right is one of our volunteers, Roy, who's installing a grab rail in a client's bathroom to help them get up and down from the loo. Technical support. I won't go through in detail this because it's all in the leaflet, but it's basically helping people to avoid rogue traders, cowboy builders, and maintain or improve or adapt their home. This is working with owner-occupiers. We maintain a list of robustly vetted contractors for people who just want access to a reliable, vetted tradesperson and want to organise work themselves. And we also have technical officers who can undertake surveys, supervise works, check that it's all done okay, project management if you will. And that technical support team also delivers emergency heating repairs, funded through a variety of sources, including in the North CCG patch, a welfare grant. That's been available in North for the past 3 years, and with some phase 3 resilience monies, we've now got a similar grant for South and Central, but that's only happened in recent weeks. So, just a couple of visual examples of technical support. This is a property in North Manchester. It's actually in Crumpsall. And an elderly lady is the lone resident in the household. She wanted, or was persuaded, to have block paving installed around her home to make it level and safe and quite pretty. She paid several £1,000s and this was the result. This is the finished job. This isn't a work in progress. She phoned Care and Repair. She was quite devastated. She couldn't believe that she'd been duped and been so foolish. And she engaged one of our contractors with technical support to remedy the work, and you can see the difference. This is a house. It's in Hume, actually, and the kitchen is basically falling to bits. The electrics are unsafe. There's an unsafe gas supply into the property. It's riddled with damp. There's mould. There's condensation. Very little clean preparation surface for food prep. That's what it looks like afterwards. So you can see it's been all the faults have been remedied and it actually looks quite nice. That's the same property. Lead pipe work in the property that had to be replaced. Significant damp that was causing the sink unit to just collapse into the floor. And that's what it looks like now. Caseworker support. I'm running out of time. So, caseworker support, home visiting, helps with all those issues. A prime focus is income maximisation. So many residents in Manchester still aren't in receipt of the welfare benefits to which they're fully entitled. The system is complex, the forms are complicated. Just a stat, £1,344,000 of extra income generated by our 4 caseworkers in Manchester last year. Hints and tips about working with the hospital or with the NHS, CCGs, call it what you will. Find an ally who gets it, gets what you do. You know, cultivate them, send them case studies, you know, make it easy for them, solve their problems, give them solutions. Don't let information sharing be a barrier. Make friends with IT or business intelligence in the hospital trust. They're a mine of information when you want to show positive outcomes of your work related to readmission rates. If you're asked to do something, say yes and then work out how to do it. Demonstrate you've got robust policies and procedures. Try to build relationships of mutual trust. That can be difficult, but it's possible. Let the NHS be pleasantly surprised by how quickly you can mobilise, because the NHS is a bit of a dinosaur and it can't do anything quickly, and the VCSE sector can and does all the time. And stay true to your mission and values, because it's all about the people. Thank you for listening.